This is the second part of our discussion of the content of Chapter 16 regarding treating clients with substance abuse and how social work figures into that field. Something I want to mention as we go into the treatment end of things, I have not personally worked in any substance abuse treatment programs, but I've had very close friends who have. And some of those individuals are recovered alcoholics or recovered drug addicts who really don't have professional credentials. I mean, they have the substance abuse treatment credentials, which are certainly very valid and important. They go through a training program in order to obtain that. But in terms of the 4-year degree, many of those individuals lack the 4-year degree, I would say, if not most. And those individuals who do have a degree in mental health or social work or human services or psychology, who try to enter into some of these programs to work, in some of these programs, will often find themselves somewhat put down or set aside because of the fact that they're coming in as a professional and not as a recovered substance abuser. And so there are different philosophies about who should be providing treatment in substance abuse, and I'm not going to try to settle that or even really address that. I think probably both philosophies have something to say that is valid. But I will say again that social workers do a lot of work, as you'll see at the end of this particular presentation, in the substance abuse field. But the 4-year degree isn't. This is one area that sometimes the 4-year degree is not really viewed that favorably, at least in traditional outpatient facilities that I'm familiar with. So, just something that's of interest to you in this particular thing, in this particular chapter. There are a lot of different ways to provide intervention for individuals with substance abuse problems, and a lot. There are 4 here that are identified that we're going to talk about, at least, and that's outpatient mental health and drug counseling therapy. Sometimes the drug counseling therapy is separate. It's just drug counseling therapy. Sometimes there's what we call a dual diagnosis, which is a mental health and drug treatment approach combined in the outpatient clinic. There is inpatient and residential therapy. Once again, can be dual diagnosis or can be specifically focused on the substance abuse itself. There are medical interventions that are used to help substance abusers with underlying problems of depression, and also in some facilities, and I'll mention this a little bit later on, some facilities treat substance abuse, inpatient facilities, as a medical problem, period, and don't even address issues about social life and those kinds of things. There's a great deal of debate about that, so don't jump to the conclusion that may be the best intervention. Self-help groups also, Alcoholics Anonymous, Narcotics Anonymous, and they really have developed over the course of the last few decades a lot of different anonymous kinds of group. Gamblers Anonymous, for instance, Parents Anonymous, which is for individuals who feel like abusing their kids. There are a lot of these groups out there, and the anonymous part the anonymous part speaks for itself in terms of identity, but also it implies that it's a self-help process. There are some AA and NA groups. It depends on the group you pick, I think, and where you go, but in some areas there are some AA and NA groups, and probably those other groups as well, that have a professional that kind of sit in or help to guide, sort of called guided help out or guided self-help groups. But most of the AA and NA groups that you encounter are ones that do not have a professional in there, at least working as a professional. There may be professionals who are substance abusers in their groups, but not there as treatment specialists. There are alcohol and drug treatment centers that are supported by state and federal funds. Generally speaking, private funds do not support substance abuse treatment. Insurance funds, most insurance programs or many insurance programs will provide for substance abuse treatment, but there has tended to be a limit on that. Now, it remains to be seen whether the Affordable Care Act is going to change that or not in the years ahead, but there have been some pretty strict limits on the use of insurance programs for substance abuse treatment. I think because the recognition is that oftentimes one of the things that happens in substance abuse treatment as a matter of routine is relapse. It happens often enough that you'll hear that people will say relapse is a part of recovery, and there are different reasons for saying that, but in any event, because of the frequency of relapse, sometimes in recovering substance abusers, insurance programs tend to restrict the use of funds, how long and how much. So, but in any event, interestingly, with all the professional different kinds of programs that are implemented, and that this includes those who have been former programs that are run by and staffed by recovered alcoholics and substance abusers themselves, the most effective appear to be, at least according to most of the studies that have been out there, are the self-help groups like AA and NA. In fact, professional substance abuse treatment programs, and I don't have the figure in front of me, but fairly commonly have very low success rates. That is, where the individual has stopped treatment and hasn't used again. It's disturbingly low. And again, I would tell you, I think that has to do with, in part, with just how overpowering an addiction can become for an individual who has an addiction. So these principles and functions and purposes of self-help groups include how are they different, and why are they effective? Well, first of all, members share a similar condition in the group and understand each other. I mean, that's a sort of a given, I think, in these self-help groups. They're the ones that determine what activities are going to be pursued in the group. They're the ones who determine how the group will work each week. They determine if there's a leader, who is the leader and how it's done. They determine all those policies. So it's a very democratic process. We know that, somebody told me one time that if I wanted to really learn about something, the best way to learn about things was to teach it. That you learn so much more sometimes in teaching things because you do all this extra study and extra thinking about things that maybe you do as a student. I don't know, but I think likewise there is a therapeutic benefit in helping other people. It is, as much as there is benefit in getting help, sometimes giving help is also therapeutic itself. And so in any event, and there's no fees. Usually, it's not commercialized intervention. The self-help groups kind of rely upon the strengths of the individuals in them. They wind up setting up social support systems that help the participants cope with traumas because of the relationship between members. Typically, in an AA or NA group, there is someone from that group somebody who's there longer and more certain in their own recovery, who is identified as a sponsor. So when a member has a crisis or has a particular need, they can reach out to their sponsor, and their sponsor is there to help them through those crises and to kind of steer them away from falling back on alcohol or substance abuse in order to cope with the crisis. So here you can see the other kinds of things. Generally, AA and NA is not considered to be as stigmatizing as going to a substance abuse treatment facility or a mental health clinic and those kinds of things for help. Self-determination is a big part of self-help groups, and again, that's the principle in our particular field that we hold dearly to. In fact, so this is the use of self-help groups and getting clients into self-help groups is something that is really very very consistent with the kinds of philosophies and values that we have in our field. Now, Alcoholics Anonymous, Narcotics Anonymous, and again, I think most all of the anonymous programs use what's called a 12-step program, and there are a lot of people really believe that 12 steps is the key, the thing that gets somebody through recovery and that helps them leave the substance abuse or whatever they're addicted to behind, leave their addiction behind. Some individuals have issues with these 12 steps because they refer to the existence of a God. And you'll see in the third step that it says to turn our will and our lives over to the care of God as we understood Him. In other words, it isn't it's not necessarily a Christian thing. God as a person understands them. So I suppose atheists and agnostics would have problems with this, because atheists don't believe in God and agnostics don't believe in anything, I guess, is how it goes. But this is one area where sometimes 12-step programs, people will tell you they don't want to go to 12-step programs because they're a religious thing, and that's the thing you have to keep in mind. It's not about religion. It is God as a person understands them, and so anyway, here are the first steps. The first 6 steps involve acknowledging powerlessness over alcohol, or again, whatever the addiction is, depending upon the particular group you're in, and that your lives have become unmanageable because of that, and then you see the process the individual goes through, acknowledging the extent of the problem and extent of the wrongs that have been committed. This moral inventory, the 4th step, is something that's very difficult for persons sometimes to really kind of honestly acknowledge what they've done in their lives and who they've hurt, being able to identify those things and those people. Once an individual kind of has done that and has moved past that and has support in the group doing that, I think you'll notice you begin to see some very significant changes in that person. I have seen, in fact, groups with parents from our own caseloads who, as a part of their own whether it was a part of their case plan or a part of their own acknowledgement finally that what the substance abuse played the role that substances played in the removal of their children, for instance, have gone into AA and NA together, and we've seen those parents sometimes in other public functions together, and we see how they interact, and I think more powerful than anything that any of the social work staff do for them or what they do for each other. Here are the second 6 steps, I should say. The second set is 6 steps, the 12 steps. And here you're listing who you've hurt and being willing to make amends, and then going out and doing those amends whenever possible. You see on and on there. It becomes very spiritually oriented towards the end. Again, God as we understood Him, but nonetheless, there is certainly a spiritual. And again, some of us may not believe in a spiritual existence at all. We may believe that we're simply animals. And some of us believe our pets have spirits as well, and maybe they do. I'm not saying one way or the other. I'm just saying to you that some of us think of of our functioning as just being physical beings, and don't acknowledge the existence of any kind of a spirit or a soul, or however you would want to refer to that. Others, of course, other cultures, and Alaska Native culture in particular, revere the spirit and see it as a very vital part of one's existence, and that ties to the past and the future and all different levels of existence. And so whether it is essentially a soul that leaves the body and goes to heaven when you die, or it's your spirit, your aura, however you want to view this and see this, an individual can become spiritual without being religious, I guess is what I'm trying to say. And again, I'm telling you this only because I think that this is one of these issues that comes up sometimes with persons that you are encouraging into AA and NA, and it's worth your time to think through these 12 steps and think about how how it does not necessarily require a religion or a church in order to carry this out. Interestingly, these meetings oftentimes occur in church basements, and it has nothing to do with the program itself or being tied to the religion. It's just because church basements oftentimes are free for alcoholics, and so that's why you see them associated with churches, but this is entirely secular. Now, Um, why this is important is because here's a 3-year study. Alcoholics who chose AA over professional help, that is going to see a counselor or a therapist or going to outpatient treatment, had a 45% lower average per person healthcare cost than those receiving professional treatment. That's one thing. Even with the lower cost, they had reduced alcohol consumption and experienced fewer days intoxicated, achieved lower rates of depression through testing and things when compared to alcoholic clients receiving professional help. And so this is saying to you that the self-help groups are more effective. Here is one study with 253 African Americans in NA and NA showed improvements during 12 months in 6 problem areas listed here, that involve employment, the use of substances, and different kinds of problems that exist in an individual's life. They've experienced problems in those, or experienced improvements in those 6 areas. Adolescent members of Alateen. Now, Alateen is a self-help group for children with an alcoholic parent, and Alateen is there's a corollary group for adult members of a family with an alcoholic parent or an alcoholic in the family called Al-Anon. So a parent, for instance, who has an adolescent who's abusing substances, or a spouse, for instance, with an alcoholic partner, have Al-Anon, which are groups that support them and help them to figure out how to deal with those individuals so that they don't encourage the alcoholism. Because one of the things that seems to be the case in many, if not most, alcoholic families is the entire family system, and this is a family system's perspective, but the family system, all the individuals in the family all play roles that permit and encourage the alcoholism of the single member. Now that's the family system's perspective, and some people would have issues with that because what that does essentially is spread I want to find another word other than blame, responsibility across the family for making changes that are necessary for the alcoholic, and I think that's probably good for the alcoholic or the substance abuser, because that's a big change to make themselves. And what it says is that we all in a family. I had a supervisor who once used to talk about the dance we develop in our family. Every family has its own dance. Everybody makes its own steps, and this is how we learn to live together. We don't step on each other's toes because we all coordinate what we do. When there's an individual in our family that has a serious problem, whether it be a mental health issue or a substance abuse issue, family members have to change their steps. They change their dance in order to accommodate that particular problem. That's how they continue to live together, and that's why family systems people will tell you that everybody's got to make a change. So Al-Anon in a way kind of helps that along by helping the sober members of the family recognize what to do. Alateen is really for teenagers with alcoholic parents, and it does much the same thing. Now the interesting thing about this particular study, and I've looked and I've read this 2 or 3 different times, and it still comes out the same way to me. Alateen members had significantly fewer negative moods, had more positive overall moods, and had higher self-esteem than adolescents who were not members of Alateen and did not have an alcoholic parent. So this suggests that Alateen members actually do better than teenagers without alcoholic parents. I have to wonder if this is really what this is what the study concluded, because this seems kind of counterintuitive, but it may be the fact. But the point is that Alateen helps its members, whether it's really exactly what's said here or not. It's of benefit to the members. And again, it's that power of the self-help that really helps individuals cope with problems and things like this. Going back to AA, an 18-month follow-up study showed that the more days group members attended AA meetings, the longer their abstinence lasted. We usually encourage our alcoholic clients to go to AA every day. And in fact, some have gone twice a day. And I know people who are in recovery, who have been recovered for years. I mean years. Who, whenever they go to a city for a conference or to go on vacation, literally the first thing they do when they go to that city is to find an AA group and go to it. That they want to connect with people. This is a serious person in recovery. This is a person who's serious about their recovery. They want to connect with individuals who will support them if they need it while they're away from home. And so attendance, the frequency of attendance at AA meetings has a lot to do with also maintaining abstinence, and as more powerful than the use of medication, even in maintaining abstinence, according to one study. Moving away from self-help group, we start looking at residential and both inpatient and outpatient treatment here. Short-term treatment first, long-term treatment next. There's been some studies like the one that's mentioned here that shows that really just very short counseling sessions sometimes can be as effective as more extensive interventions with older alcohol abusers. Now, again, remember what we said a little while ago about in a previous slide about this previous lecture rather, about older adults and that they're not provided with adequate substance abuse treatment. So this is interesting here that they're saying here, well, 2 or 3 10 or 15 minute counseling sessions is just as good. And you have to filter that information based upon what you've heard elsewhere as well. But brief interventions can be effective in reducing consumption and binge drinking and things like that. Sometimes people with alcohol-related problems will receive counseling from their primary care physicians, that is a doctor or a physician, nursing staff, or even an emergency room. And they suggest that as many as 40% of trauma patients seen in an emergency room may be alcohol dependent. And that just reflects again the significance of this particular problem, the significance, how poorly we handle alcohol in our society. Remember, we're thinking about adding marijuana to this as a legal substance. As far as long-term treatment goes, dropout rates for inpatient treatment programs is 28%. That I don't know that is particularly bad. I think it's probably comparable to dropout rates for lots of treatment programs that are court ordered. But 75% of the outpatient alcoholic patients in their study dropped out of treatment before their 4th session. So this does suggest that inpatient treatment may be more effective in keeping an individual involved and engaged in treatment. They had a question, Wolitzer and others, and this is certainly not the only study of this, but the question of what can we do to keep clients who are entering an alcohol treatment program in treatment? What are the best things to do early on to keep people engaged? And they tried control groups, 126 clients, into 3 different groups. One who received a role induction session, and a role induction session, I think a session is essentially talking about, I'm here to help you, and this is what you're going to do, this is what I'm going to do, and this is what you can expect, and can you identify your problem, and those kinds of things. Okay. Then a motivational interviewing session. Motivational interviewing involves I think it's a 5 or 6, at least as I have been trained in this, a 5 or 6 step process where essentially you have to assess where a client is in terms of their willingness to change, and then you begin to by helping the client to identify the areas that seem to be problems, and if they don't see problems, you work with them to identify problems. You don't go ahead and say eventually, well, you have a problem here and we're going to give you treatment regardless. You keep working with them until they recognize at least that there is a problem of some nature in their lives, whether they identify the same problem as you, and then you begin to help work them through a process of recognizing what it is that they want in their life, what their goals are for themselves, and what they believe about themselves, and then to help them recognize how the particular issues that they have contradict their goals and their beliefs about themselves. Is called creating discrepancies in their thinking. Help them recognize that what they think about themselves or what they want for themselves is undermined or is eliminated by the particular thing that's going on in their life that is the problem. And then through that, the idea is that individual then is motivated to change. Remember what Carl Rogers said, if you've done any study of humanistic psychology and all of that, you know that the human individual has a natural inclination for self-improvement. We're always reaching to become better and to become more of ourselves, who we are, and to become a better person and more fulfilled, and not in a negative way, but in a positive way. And so motivational interview kind of, in a sense, kind of taps into that and says, you know, that when we recognize that what we're doing is hurting ourselves, we then be motivated to change that. And then finally, no preparatory control session group at all. And well, obviously the amount of time I gave to the MI piece, you kind of gather that the motivational interviewing group was the one who attended more sessions and had fewer heavy drinking days up to 12 months after treatment compared to the other groups. I think it makes total sense because, again, through the MI process, you are helping the client reach inside himself or herself and identify what's going wrong, and recognizing why the change is necessary. And when we have that from inside of ourselves, change can happen. When it's imposed from outside, it's a long, slow process. If you're not familiar with motivational interviewing and in a social work program at some point, hopefully you will get exposure to motivational interviewing. If you don't, there are MI training sessions out there. Just look around because it's something that's worth learning. And motivational interviewing is something that has become very popular, probably because of this, in substance abuse treatment, in fact. Because, you know, the client has to recognize what the substance abuse is doing to their lives before they're really going to want to change it, because they're addicted. They have to have good reasons to overcome that addiction. In Alaska, our child protection work has begun to incorporate motivational interviewing also in terms of creating positive change with clients. Now here's some, this kind of ties back into something I was telling you earlier, which is that you know, there are not a lot of rehabilitation programs in substance abuse field that have evidence to show that they're effective. And you know, again, this goes back to what I was saying earlier about the low success rates in this particular field. You see advertisements, I've noticed this frequently lately, you know, for I think kind of high-end addiction treatment programs, resort and spa private clinics is what it's recalled, you know, where people with a lot of insurance money or a lot of money can go, and it's sort of you know, a higher end treatment program where you're, I guess, not mixing with people who have been down and out so much, you know, people that have resources and things, and I sound a little mocking with that, perhaps because I'm not sure that it's really of benefit to you know, to go to one of these places with the wonderful facilities any more than it is to go to a facility run by the Salvation Army, for instance, which, you know, which will be cheaper and may be just as effective, or no less effective at least. And these private clinics a lot of times won't allow researchers to go in to verify their claims about success rates, and so it's really not known for sure. There's nothing to really verify or back up what they're saying, or even to, for that matter, to understand how it is that they're defining success. There is a program in Washington State called Schick Shadle, which actually I think they use a program where they say you will be the treatment is a 10-day inpatient program. It's exceedingly fast. Many of the initial inpatient programs that you'll encounter in Alaska and other places are 28 days. It's a month for you know, getting sober. Schick Shadle is 10 days. Schick Shadle specifically says this is not a 12-step program. We don't use 12 steps. It is a medical intervention. And again, there are a lot of issues that professionals have with that. While it can certainly, you may be able to get your system clean of substances and intoxicants, and so deal with that withdrawal from the addiction, let's say, successfully. When you go home, if you haven't changed all of the kinds of things that have been going on, your coping style, for instance, if you haven't learned new coping techniques for stress or whatever it is that caused you to do substances to begin with, it's going to be very easy for a person to fall right back into those old habits again because they've got to have other things in place. And so I would assume that Schick Shadle and other similar facilities would arrange for those services when that person gets back. There's different approaches to treatment that I see one program on television these days that says that if you relapse, you get a free 30-day treatments. Come back for another 30 days. So if you got enough vacation time, I guess you can do that. Nobody knows what approach is best for any one patient. It's really going to, and this is of course part of your job as a social worker, is to determine what approach is best for your client. Programs rarely track clients after leaving a program, and at least for any length of time, and so there's so much research that needs to be done. And I know that some programs do follow-ups, but particularly with this population and for those clients who are not succeeding at the end of the treatment program or 6 months later, whatever, many of them are not going to want to respond. And so I think there are particular problems with long-term follow-ups unless there's an independent person that's out there knocking on doors trying to get the information. It's a great study for you if at some point you need a project, is to determine success rates for a particular kind of program. Interestingly, many of the people who graduate from programs feel like they weren't really helped, but so there's this thing where you're really kind of going through, not necessarily going through the motions, but taking all the steps, but something underlying the problem hasn't been addressed, and so. Another interesting thing here is those who have remained sober for 5 years or more really kind of are the ones that have maybe done it on their own or with the help of an individual therapist. Now, most people believe that abstinence is the first step that's necessary in the treatment of substance abuse. To achieve abstinence, is to first become abstinent and then move on from there. There are those who, and there are treatment approaches that disagree with that and don't necessarily maintain that abstinence is necessary, but those are, I would say, are the outliers in substance abuse treatment. And when you have a program with a client in a program that doesn't require abstinence, I would, just from based on what I know, I would suggest that you should keep a close eye on things because there's most experts in this field believe abstinence is the first step necessary. You see the second step, which is what I've been talking about, finding coping skills. How do you prevent a relapse? And cognitive behavioral approaches, sort of the relapse prevention model is what's called. It's also the model that's used with sex offenders in treatment of sex offenders. This is the idea of identifying your high risk situations. First of all, let me back up. First of all, identifying what the stressors are in your life that kind of set up this cycle for substance abuse or the cycle for the sex offender for sexualizing their thinking, and then to identify what those high risk situations are that put you in that situation and avoiding those situations and finding other ways to cope with those circumstances and things so that you can manage the successful situation without triggering the use or abuse of substances. And then, having done that, kind of dealing with the superficial thing of managing stress and responding differently, then is to look at the underlying issues that contribute to the substance abuse, and that would be things like depression, self-loathing, self-worth, those kinds of things. And this is probably the therapy part, really helping the client to begin to change those things so that those events that create the stress maybe don't create that stress anymore. So you see, first, abstain. Second, find new coping methods. Third, look at underlying reasons. Now, there are people who believe that they found the most effective method was to recover without professional help, and it says that as many as 90% of all problem drinkers never enter treatment and may end their alcohol abuse without any form of treatment. This is from a 1996 study. 82% of the alcoholics that they studied in this particular, in the Sobel study rather, terminated their addiction by using what they called natural recovery methods, and we're going to touch on what they are here in just a second. But smoking, for instance, that ex-smokers discontinue their tobacco use a lot of times without treatment, and there are those that say that tobacco is one of the hardest substances to withdraw from. But that many addicted substance abusers mature out of a variety of addictions, including drinking and narcotics use, just as they grow older. For those that have real substance abuse problems, I haven't necessarily seen that personally in the field, but that doesn't mean it doesn't happen. The natural methods that they're talking about here to end drug addictions include things like discontinuing relationships that are toxic and that encourage substance abuse, those kinds of things, and also discontinuing relationships with drug users. I mean, those people that use substances for social reasons or for whatever reason it is, if you're in recovery and you're trying to remain substance free, going back to the group of people that are using substances and drugs is certainly going to make it difficult for you to stay in recovery. Avoiding those environments where drug use is likely to occur. Gets back to staying away from those high risk situations in the relapse prevention model, I should say. Setting new goals and interests in one's life. We always do better in change if we have a reason, if there's some vision we have of the future without that abuse. Using friends and family to provide support. These are all what we call natural helping processes. Middle-class alcoholics who use natural recovery alone without professional help or the use of self-help groups and who are successful tended to be overly religious. That is, that I think they kind of relied upon their religion in order to create the change they needed to change, and it worked for them. Others believed that alcohol was a disease and that there was just a lifelong struggle with that. So the disease model of alcoholism, by the way, is a very prominent model. A lot of people believe that this is something that alcoholism being a medical problem, that it's going to be something that the alcoholic will have to deal with throughout their lives. So with the treatment that's being used, and here you can see some numbers, I'm not going to necessarily read them to you, but a lot of people getting treatment for alcohol and drug abuse issues, whether inpatient or outpatient, millions of people. Kind of the breakdown, it seems like most people are getting help and treatment at a mental health center as an outpatient for their substance use problems, but there's a number of different places, including jail, where people get treatment. And what do social workers do in this field? And here's a list of some things, and I'll just touch on a few of these. Inpatient and outpatient clinical services. As I mentioned earlier, sometimes the role of the professional in substance abuse treatment is viewed unfavorably by some, just because of the fact that there is a large element of people who believe that in order to receive or to provide treatment, you had to have had an addiction yourself. That's just a philosophy that you run into a lot in this particular field. Organizing or sometimes co-leading self-help groups, like I mentioned earlier, those guided self-help groups. Counseling clients in individual and group sessions to help them deal with their substance abuse issues. Interviewing clients, collaborating with others who work with persons who have substance abuse issues. Generally speaking, any client you encounter in the social work field, but especially substance abuse clients, you're going to find have what we call multi-problems. That they really need services from a number of different people. How to do that in a way that doesn't become overwhelming for the individual is a part of what we call case management, and so that's one thing a social worker does a lot of, is helping to coordinate and orchestrate, really, the provision of services to individuals with a variety of problems. Education is something that certainly has a lot to do with what social workers do in this field, helping the clients, providing support and guidance and encouragement in complying with treatment plans that are set up with the provider, wherever that provider may be, and that might be getting them to appointments or arranging for transportation, those kinds of things. Oftentimes, substance abusing clients have a lot of other issues. This is why I told you that almost everybody in social work works with substance abusing clients, or has substance abusing clients, because they have so many issues. And here's some things, sometimes basic needs like housing and food stamps and those kinds of things, proper diet, medical care, those things, so that the social worker is going to be referring those individuals to many different agencies or providing services when referred to them. Helping family members, of course, and assisting them in understanding and dealing with the particular problems that abuser is faced with in the home. And finally, increasing our own professional knowledge through reviewing literature, conducting research, and those kinds of things. So continuing education is something you're going to want to have all along anyway. So this is one area where we all need continuing education. In fact, in order to maintain your clinical license in social work, you have to have just a few hours of training in substance abuse field every 2 years. So the idea is social workers are encouraged to stay current in substance abuse treatment issues. That concludes my presentation on the content of Chapter 16 in the Galic text. So I hope that you found some useful information in this particular lecture, and we'll look forward to talking with you again when we cover the next chapter.